So I'm so excited to be training you guys with these videos. I got everybody here learning, and you, whoever's watching, and we are going to put braces and start the start appointment. This is a start appointment on our patient, Emily. You're Emily today. And so going through the whole process. She actually works here, but we're gonna treat her like if she was a real patient, okay? So the first thing that we do at a start appointment is verify that the patient has a pano within a year. If the patient doesn't have a pano within a year, we need to take that pano. We also need to verify that the patient has photos, which usually in this office, they won't have photos from the consultation appointment. We usually take those initial records at the start appointment. So we'll be taking those today, and then we're gonna go ahead and put the braces on. So it's gonna be awesome. All right. Okay, so first we're gonna start with the initial picture. So Jennifer, can you get up and go to this? All right, so the first picture is gonna be a frontal picture. She could be smiling, and everybody knows you, Katie. I would take a picture of the name first, okay? Then start these pictures, because when you start downloading them into the system, we need to know who the patient is. So make sure you take a picture of the name on the router, or you could even take a picture without flash of the chart, the patient's name on the chart. That way we know. So that's gonna be your first picture. So then after that, you're gonna start your pictures, okay? I'm not a good teacher, okay? But we have a lot of people learning, so it's like, has to be done. It has to be me. I wish I was the camera person. Okay. All right, and go ahead, perfect. And then now we're gonna do a profile. Perfect. So, and then have a seat. So the first one is gonna be facing the camera with no smile. The second one would be with a smile. So it would be no smile, with a smile, and then with the profile, just like that. Now, the patient might be really like self-conscious at this point because we haven't started braces. So their teeth, they might not be used to smiling, but just assure them, this is just for your chart. Like, this is not going anywhere. We just need it for records, you know what I mean, if they feel it. So don't feel embarrassed. And, you know, at the end, you're going to love your smile. It's going to be a good journey. You're going to, you know, just keep reassuring the patient and all that, okay? With positivity and things. I'm a little nervous, guys.
Don't be nervous.
I'm not good with the camera. But this is like a perfect video. I'm so excited for this video. All right. So then we're going to do the picture, the intraoral pictures. So go ahead, Emily, and hold these right here. And keep that bite there. Awesome. The first one is going to be with the bite. You're going to put this one right. You're going to take a picture just like that. You always want to have the flash on if you're in a dark room, because you want to get this. These initial pictures are going to be important. Then you're going to loosen up on this side. You're going to pull more on this side. And you don't want the camera to be facing down. You don't want the camera to be facing too high. You want to kind of be just right parallel. Get a good shot of the bite. I typically tilt it just a tad bit up. So just a tad bit up, just like this. That gets a good picture. You can get in here and see that. See, just like that. That gets a good picture right there. All right. And then we're going to do the same thing on this side. We're going to get this picture real good. Right here. Perfect. Now we're going to do the upper and lower occlusal shots. Oh, I hit my head with that a lot. It's part of being a dental assistant. All right. And you're going to hold these up. All right, you're gonna have the patient hold them up, and you're just, can you hold these up for me? Because I know her. So that's why I'm not doing all of this, but I should probably be doing it like I don't know her. So can you open up, please? And I'm gonna go ahead and put it in a V shape. And can you just hold it from the top? Excellent, just like that. I'm gonna go ahead and put this mirror, gonna get a nice shot of your upper teeth. And you literally bring the mirror in just like this, nice and gentle. And you're going to make the mirror and the image come out straight. So a lopsided image looks like this. If you're looking like this, if it's getting like this, it's lopsided. You want to make sure that that image is nice and straight. Just like that. All right. And I am using the larger angle, not the smaller angle, because she is an adult. So on the phase 1 or smaller kids, we use the smaller, and on the adults, we use the bigger, okay? So just like that, make it straight. And once you've made it straight, and you get a good picture just like this, all right? This is a good picture. This mirror's a little scratched. Gotta get new ones. All right, good. And then the same thing on the bottom. So you're gonna hold these the same way, but on the bottom this time, okay? And go ahead and hold those down for me. Tilt your head all the way up. And we're gonna go ahead and get this picture just like this. Awesome, make it straight. Excellent, perfect. And that's how you take the initial records. Setup is gonna be like this, and the setup is really important because while you're in the patient's mouth, it's not really convenient to be grabbing stuff or to be having to get up and get stuff. So you really do wanna be prepared as soon as the patient is seated in your chair. And this is how I like to set up my bondings, just so that you can see. So first things first, obviously we need to keep the area dry, so I have my cheek retractors. And with the cheek retractors, I always have some cotton rolls, and I always have some 2x2s, and you'll see why in the near future here. Then I also have my edge, of course. So the edge is first in a bonding, right? Because we need to make sure that the tooth is nice and dry. Then we have our bond. We have our brackets, our bracket holder. I put my glue. I'm like so OCD about this, like, okay. And then I have my light. So boom, 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 boom. And this is literally the steps in the order that it's gonna go. And now that we're set up, it's gonna go extremely fast. And they explore to position it and to clean the glue off. This is the order. And you can take a picture of this if you want. And so that you guys can kind of memorize it, and you'll see me go in order as I'm in the mouth. All right, so I'm gonna get her started. So go ahead and put these glasses on. This is for protection of the eyes, and also if you do use the light for any reason, it does kind of like give comfort to the patient so that the light's not in their face. But for the most part, it's for protection for their eyes. And of course the bib to protect their clothes, right? We're gonna go ahead, and a lot of times I like to start with a little bit of Vaseline. Where's my Vaseline? Here. And so what I do is I take one of these cotton rolls. Once you dipped into the Vaseline, you're gonna close it. Clean gloves still, put it in the corner. We're not using that anymore, okay? Everything has to be sterile. Everything has to be nice and clean. Like I said, guys, I am not a pro at making videos. I am just doing this because I wish I had this when I was learning. And I'm doing this for our team too. I love our team. And so I put the Vaseline to make it comfortable for the patient because these cheek retractors are stretchy. I always have the patient relax. So relax, patient. And I'm gonna go ahead and I'm gonna get these cheek retractors in. Notice the flaps are the first things that go. A lot of people are nervous about putting these cheek retractors in. This patient is fine, okay? We are not performing surgery. Nothing here is a big deal, okay? You see here, I have it lopsided. She doesn't even know that, okay? So just put the flaps in on the cheek retractor and then get the lip around it and take your time with it, okay? Don't struggle with it. If the patient sees you struggling or you nervous, the patient's gonna get nervous, okay? Before I start with the edge, I dry the teeth. I dry the teeth real good, just like this. And then after that, I go ahead and I start with the edge. Now with the edge, I'm very careful. Sometimes I bring the entire tray here. But I do not hold it over the patient, and notice, I'm just very careful with the edge, and we all know why, right? If we graduated from dental school, not dental school, dental assisting school. Oh, our patient here is going to be a dentist one day. We're really proud of her. So you see, I'm literally putting the edge, a little bit of edge on every tooth, literally like painting nails. Am I getting close to the gum line? No. We don't get close to the gum line, and we make sure we stay away from the lips. Why? Because the edge is acid, so it will, or some sort of acid. You know, I don't really know the chemistry of these things, but I know that it's dangerous and it can burn. It can burn your gums and your lips if you're not careful with it, you know. It's just a chemical we want to be very careful with, okay? And I have edge on all my teeth. Now, we can go ahead and rinse out this edge. How's the lighting? Good? Pretty good. All right, awesome. And now we can rinse out this edge. Now I'm very comfortable rinsing out this edge because the patient has her bib. It's not gonna get on her clothes. The patient has the glasses, it's not gonna get in her eyes. If I didn't have the goggles or the bib, I'd be feeling very uncomfortable rinsing this out because it does splash sometimes, okay? See that? You get a good rinse of the edge out. Edge does not taste good. So a lot of times you can warn the patient, you can let the patient know that it's gonna taste a little gunky, okay? All right, and then I'm gonna finish rinsing it out. All right, and open big. I get back here, under the tongue, all right, everywhere. All right, and if it did get this patient, I'm very comfortable with this patient. Sorry, Katie. Okay, don't do that to your patient. Okay. Anyways, so now I get a cotton roll again, another cotton roll. And notice I'm taking from the same, and I'm going in order of my setup. I'm gonna take the cotton roll again, and I'm gonna go, and I'm going to. Now usually, I'm just try the teeth. Now usually we would go from molar to molar, prepping the brackets for the doctor. But because for this specific case, the doctor just wants me to prep from premolar to premolar, so that's what I'm gonna do. But usually for most orthodontists, you'll be prepping from molar to molar, okay? So that's what I'm gonna do. See? And now you see that they're chalky white after the edge. So they're ready for these braces to go in. Okay. First, of course, you're going to do the bond. And many people use the L-pop. I go ahead and I squeeze out all the L-pop until it's nice and yellow. Okay, this is the same thing as bond. The only difference with an L-pop is that this bond has edge in it. So again, you're going to be very careful with this, even more so than the actual edge. All right, you're gonna paint the tooth. Notice I'm not going anywhere near the gum line. I'm literally just painting where the brace is gonna go. Remember, the first step is edge. This step is bond. Okay, so you're putting the bonding agent in. All right, you see, just like that. You see that? How long is the video so far?
5 minutes.
All right, we're good still. Doctors take out up to 40 minutes to an hour for this appointment. So you got plenty of time to do this, okay? Just like this. We're gonna do premolar to premolar because that's what the doctor asked for. Okay, we always do what the doctor asks for. And we prep the tooth. Just make sure that everything's nice and juiced up. Now we're gonna go ahead and move to the next step, which is actually placing the brackets. Actually placing the brackets on the teeth, all right? So notice, I grab the bracket. It's usually labeled on your actual card what bracket it is, okay? You're going to, I make sure my fingers are nice and dry. You're going to put a pea size of glue on the bracket. You're gonna just tap. Make sure it's nice and flat on the entire surface of the bracket. And then you're gonna go ahead and you're gonna put it in on the tooth. You see that? Always start from the back first. So if you're doing 6 to 6 or molar to molar of prep for the doctor, prepping these brackets for the doctor, then you're going to start with the 6s on both sides, okay? But just to show you how I do, I'm gonna do the back ones on this case first. Now the reason that you do the back ones is because right now that light is drying our bracket as we speak. It's something that you do gotta be speedy in, okay? But I mean, it's not gonna dry right away, but it will dry if you're taking an excessive amount of time. All right, you can also cover, and you'll see how I cover it when I'm actually removing the excess glue off of the bracket. You'll see how I cover it. Let me see if there's, oh, there's more patients. Can you get the next patient?
Yep.
Sorry.
Yeah, you're good.
All right. You see that? Just like that. Just like that, a pea size right here. You see that pea size? Flattening it out. And I put it right here, just a pea size. Don't need too much. Don't need too much. The more glue you put on, the more glue you're gonna have to clean up later. All right, so just remember that. Same thing. Okay. Pea size, little pea size, boom, just like that. Not a lot, all right? And put it in. And sometimes while I'm doing this, if I was doing the back ones, you'd be seeing me cover it every so often, just to make sure. Now I get my 2x2, and we're gonna clean some glue off. All right, you're gonna go around, and you're gonna clean off the glue. You see? Just like that. Now we see that we're getting some buildup of water on the back, okay? So we're gonna suction the patient as needed. And notice I'm not getting anywhere near the bracket when I'm suctioning the patient because I don't want my brackets to get wet. The brackets get wet, it's over. Gotta start over. They have to stay very dry, okay? All right, and I cover as I go. But just for the sake of this video, I'm just gonna move quickly here, just for the sake of the video, okay? As you become an experienced assistant, you're gonna kind of get an idea of where the doctor puts the bracket, and you can actually even put it where you think he's gonna put it. So for example, and I might be way off here, but I believe it's gonna go like right there. See? And so I can put it there for him. Get it as close as possible to where you think he's gonna put it. But if you're just a beginner, just go ahead and put it on the center of the tooth just like this, and he'll get it, okay? He or she. We work with 2 of them. They're both wonderful. We're gonna call them Dr. Blue and Dr. Red. Oh. Ay, ay, ay. All right, just like this. You see, you're getting this, right? Just like that, all right? And so now I'm gonna just kind of let him know that I'm ready. Ready to bond. Just like this. And if he weren't to, he's coming right away, but if he weren't to be coming right away, we would cover it. Just like this until he can.